You know, if you or someone you care about is struggling with that really nasty back and leg pain, you've probably come across the term degenerative lumbar spinal stenosis. It's actually one of the most common reasons older adults end up needing spine surgery. But here's the thing. Once surgery is on the table, you're faced with a huge choice, and it usually boils down to two very different approaches: decompression versus fusion. The decision you make has some pretty major consequences.
So to really get to the bottom of this, we're not going to just go off of stories or opinions. No, we're going straight to the hard evidence. We're going to break down what the clinical guidelines, like these ones from the North American Spine Society, and the big, important clinical trials actually tell us. This is all about looking at the real data, so you can understand the choice. All right, so what is this condition really? Well, think of it like this. You have a tube in your lower back, the spinal canal, that holds all your nerves. Over time, with age and a bit of arthritis, that tube can start to get narrower. And that narrowing creates a pinch on the nerves inside. The classic symptom? You get pain or maybe numbness or weakness in your legs when you stand or walk. But the second you sit down or lean forward, say on a shopping cart, you feel almost instant relief. Okay, so when that pinching gets really bad and other treatments just aren't cutting it, you and your surgeon have to consider two main surgical paths. And it's a really fundamental choice. Are you just trying to create more space for those nerves, or do you need to go a step further and actually create more stability in the spine itself? The two options really boil down to a pretty simple idea. On one side, you have decompression alone. The best analogy for this is uncapping a pinched straw. The surgeon basically goes in and removes a bit of bone and ligament to give the nerves more breathing room. Simple as that. But on the other side, you have decompression plus fusion. This does the same thing, but then it adds hardware, screws and rods, to lock those bones together. It's like bracing a wobbly fence post to make sure it doesn't cause problems later. So, the million-dollar question, which one is better? Well, to answer that, we need to look at some top-tier evidence. And you really can't get much better than a major randomized controlled trial, the gold standard of research, that was published in the New England Journal of Medicine. It put these two surgeries head-to-head in a study that folks in the field call the SLIP trial.
Let's jump right into the results. This chart is showing how much people's physical quality of life improved 2 years after their surgery. And you can see it right away. I mean, both groups definitely got better, which is great news. But the group that got the fusion reported a significantly bigger improvement. That difference might not look huge on paper, but doctors consider it clinically meaningful. It's a difference you can actually feel in your day-to-day life. So round one goes to fusion in terms of how patients felt.
But, and you knew there was a but coming, right? That extra little bit of benefit didn't come for free. To get that slightly better outcome, patients had to go through a much more intensive and invasive surgery right at the beginning. And here's what that cost looks like in the data. The fusion group, well, they had a lot more blood loss during the operation, and they had to stay in the hospital longer to recover. So the trade-off starts to become really clear, right? It's a bigger, tougher operation up front for what might be a better outcome down the road. But that is not the whole story. Now this is where things get really dramatic. We have to look at what happens a few years later. 4 years after that first surgery, a whopping 34% of the patients who only had the decompression needed a second operation. Compare that to the fusion group, only 14%. That means the decompression-only patients were more than twice as likely to end up back in the operating room. So yeah, decompression is a smaller initial surgery, but it looks like it might not be as durable for the long haul. Okay, so that trial gives us an amazing snapshot out to 4 years. But what happens if we zoom out even further? What do other long-term studies tell us about how patients are doing, 5, 8, 10 years after their surgery, no matter which type they got?
Well, one of the real landmark studies in this whole field is called the Main Lumbar Spine Study. They followed patients for years and years. And what they found was pretty consistent. Compared to people who didn't have surgery, the patients who went for the operation generally had much better outcomes with their pain and their ability to function. And that benefit really held up over time.
And that finding isn't a one-off. It's actually echoed across a ton of medical research. When you look at all these different studies that follow patients for anywhere from 4 to 10 years, a really consistent picture starts to emerge. A solid majority, somewhere between 60 and 70% of people who have surgery, report good or excellent results. Now, it's not a perfect fix for every single person, and sometimes the initial big benefits can fade a little bit over a decade, but for most people, surgery gives them real, lasting relief. Okay, let's pull all this together.
We've looked at a huge, high-quality trial, we've looked at long-term observational studies, and what it all points to is a complex but actually pretty clear surgical trade-off. It's all about weighing the risks and the rewards.
And that brings us right back to the core question, the one any patient has to ask. When you look at all this evidence, is going through that bigger, more intense fusion surgery, is it actually worth it? This table really lays it all out pretty nicely. If you go with decompression alone, you get good improvement from a less intense surgery, but, and it's a big but, you have a much higher risk of needing another operation. If you add the fusion, you get a slightly better quality of life and, here's the kicker, a much, much lower chance of going back under the knife. The price you pay is that bigger initial operation, more blood loss, and more time in the hospital. As you can see, there's no single right answer here. It's all about what a person's priorities are.
And that leads us to one final, really interesting thought. See that big trial we looked at? It used traditional open surgery techniques. But today, surgeons are getting better and better at doing these operations using minimally invasive approaches. So the huge question for the next decade is this. As those techniques improve, can surgeons give patients the long-term durability of a fusion, but without that big upfront cost of an open operation? Because the answer to that question, well, it could change this entire equation.